You know, every year thousands of people undergo LASIK eye surgery to correct their impaired vision. But when you go online to research the procedure, you'll get conflicting messages from patients. So I sat down with one of the area's biggest providers of LASIK eye surgery to try and separate fact from fiction. So if you go under the laser, you know your risk.
Make no mistake, when a local meteorologist committed suicide after undergoing eye surgery, it sent out a shockwave of fear.
What do you tell patients when they're really afraid?
We've been doing LASIK surgery here for 20 years, and we've never had anybody who's lost their vision or gone blind from LASIK surgery. We've further never had anybody who's committed suicide from LASIK surgery.
Dr. Howard Adelson of the Adelson Eye and Laser Center says Jessica Starr underwent a surgery called SMILE, not LASIK.
SMILE is a new procedure. It's been approved for approximately 2 years now. And there's still a lot about SMILE that we don't understand.
During LASIK, your surgeon creates a thin flap. Once lifted up, a laser smooths out the underlying tissue, improving vision, often to 20/20. SMILE creates a small arc-shaped incision in the surface of the cornea. A tiny lenticule is removed and the shape of the cornea is altered, correcting nearsightedness. According to the makers of SMILE, 1.5 million procedures have been performed all over the world since 2011. Compare that to over 2 decades. LASIK has been performed 19 million times in the U.S. with a 96% satisfaction rate. Heidi Rich, who had trouble seeing colors for her job, had LASIK eye surgery done by Dr. Adelson in December. She says she was not fearful about cases of suicide or pain.
Did you talk to anybody about it, or did you just sort of dismiss it?
So I did a little bit of research on it, and what I found it was an article that said out of 775,000 LASIK procedures that are done in the United States, there have been 2 cases.
Due to medical conditions or other screening methods, some patients are not candidates for LASIK or SMILE.
A fair amount of patients, probably about 20%, are turned away from surgery because they're not good candidates.
It's also important you do your own homework.
It's not about the cost, right? It's about the person who's doing it and the experience.
Exactly. Experience is everything.
And albeit rare, there are cases that give you pause. This woman lost her only son to suicide after LASIK. He was in the military.
And the pain was described as needles in his eyes.
He complained of severe pain.
Long-term pain is extremely atypical. For patients to have surgery and have a little bit of burning and tearing for 3 or 4 hours after the procedure while the eye is healing is normal.
My son put a gun in his mouth, and my child pulled the trigger.
He wrote this suicide note saying he could not live without his eyesight. Holly Coffer started an online support group. 6,400 people have joined it, and it's growing, with more stories linking eye surgery to suicide and pain.
If anyone understood the consequences of this surgery fully, there's no way anyone in their right mind would do this surgery.
Dr. Adelson and the LASIK industry as a whole stand by LASIK, which is even used by the military, saying 96% of patients are happy with the results.
I don't think I had any worry because everyone had great results from it.
LASIK eye surgery is an elective procedure that will cost you $1,000 and $3,000 per eye. What's most important, as we've said, is that you do your own homework. Go to an experienced surgeon who can go over your health history and advise you whether or not you're a good candidate for LASIK. So very important, Dave.
Yeah, a lot to think about there, Carolyn. Thank you.